Hello, welcome to my channel. This is Dr. Ravel Martinez with another tip for us foreign graduate veterinarians going through the ECFPG process to get licensed here in the US. For today's tip, it'll be continuation of the CPE surgery tips. It'll be surgery tips number 4. Let's start off. So I know I mentioned earlier about holding the forceps when you're trying to make your ligatures for the pedicles. So just wanted to clarify it again because this is one major mistake that I don't want you to make, even in real life, in practice. So I forgot to bring my caramel from the clinic, but I brought in my scissor. So what I'm trying to say is, once you have your caramel on your right below the ovary, put 2 caramels. When you're trying to move that tissue to the side, never put your fingers back on those loops. And the reason is, if you try to move it like this, there is a chance that it might come open. So when you're trying to move the tissue using the caramels, always hold it here in the middle, not put your fingers back, because chances are, and it's a very big chance, that that instrument might come undone, and that will be very difficult to find, and a big mistake that will cost you much time to try to find that pedicle if you haven't shown it to the examiner yet, or heaven forbid there's a bleeder and you forgot to check whether or not the pedicle is completely not bleeding. So again, never put your fingers back in that hole unless you're trying to remove that clamp. Always hold it here. Hold it here like this, but never put your fingers back. Okay, so the other thing, and I experienced this the other day. I was doing a spay on I think an 11-month-old German Shepherd. So there is a lot of bleeding that I saw during the surgery. Always use, and that most of it is from the skin, and I would always want you to use the mosquito forceps to occlude any small bleeders, because sometimes if there's a lot of small bleeders, it might have an effect of pulling into the body cavity, which will make you think that there might be a bleeder inside. All superficial bleeders, as much as possible, use a mosquito forceps to try to occlude it, so that it's one less thing for you to worry about. Those little bleeders, if there's a lot of it, or if it's constantly gushing a little bit of blood, just occlude it. The other thing would be, so before you're able to place the clamps on the pedicle, one of the main problems, especially if you're not used to doing space, is breaking the suspensory ligament. Especially if it's a big dog, that suspensory ligament, it takes practice and a lot of patience to try to break it. What I would always recommend is to hold the ovary and then use the pointing finger. So hold the ovary taut, so it's nice, so that the suspensory ligament is nice and taut, and then have your finger go as deep as possible. The closer you are to the body wall, the easier it is to break that suspensory ligament. So don't just hold that ovary taut and then have your finger go into the body cavity. You can just follow that ligament, and as far as you can, or as deep as you can go, start removing or start breaking that suspensory ligament, because it's easier, based on my experience, to break it as deep as possible, as closer to the body wall. The other thing would be, so sometimes the broad ligament is not very fatty. Sometimes it's fatty. I know we were taught to do traumatic hemostasis, which is you get two clamps and then you just put it on top of each other and then sever it apart and then look for bleeders. When in doubt, I would, if it's a fatty dog and it's just like so much tissue, I would always want to do that extra step of ligating the utero-ovarian vessels. Then the reason is, if there's a little bit of a bleeder and you checked it before you release that, if there's a little bit of a bleeder, it might confuse you that, oh, there might be a big bleeder that's coming in from the abdomen. Make sure to reduce the bleeding as much. It will reduce your anxiety, definitely, but you always have an option, instead of traumatic hemostasis, to just put one simple interrupted. Just put a knot, and to make sure that the utero-ovarian vessels are securely occluded. That will save you so much time. So just find that tissue and make sure you're not poking the main blood vessels. Just do that instead, and then do your traumatic hemostasis, and then let it inspect. Always inspect before you let it go. Always inspect. Better to look at it now and see, oh, it's still bleeding, and then put another tie into it, rather than it's bleeding, oh goodness, now I have to go back and try to find it. Always err at the side of caution, so that you don't have to do something that will increase your surgery time. Again, time is of the essence. You are timed during the exam. So those are the tips for today. I think my time is up. Watch out for my next video. Again, some of the pictures, I'll start posting it on my Facebook page. Again, you can always add me up, DVM Rovell on Facebook. Like I'll start posting pictures. I'm not good yet at live videos for recording. Usually I'm just busy doing surgeries, but I'll try that in the future. But to all of us studying to get licensed here in the US, just keep on doing what you're doing. Put as much effort into it, and at the end of it all, everything will be rewarding. Thank you very much, and happy studying. Bye-bye.